Good afternoon. Welcome to our weekly COVID-19 update for the town of Plymouth. I'm Steve Triffletti, Plymouth Town Moderator. We're here each week at noon for this update. And just a reminder, next week, because of the holiday, we'll be joining you on Tuesday. This is update number 72. This forum is being brought to you live by PAC TV on Comcast, Channel 15, Verizon, Channel 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email plymouthinfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. Today's participants include Kenneth Tavares, Matthew Muratore, who's also joined by Plymouth State Representative Kathleen LaNatra, also Dr. Philip Triffletti, Barry Potvin, he is the Professor Emeritus from Yeshiva University, Matthew McDonough, Plymouth County Register of Probate, Erik, Cioffi, Assistant Superintendent, Plymouth Public Schools, and also Stephen Cole, the Executive Director, Plymouth Regional Economic Development Foundation. And each week we begin with Ken Tavares, the Chair of the Plymouth Select Board. Ken, busy week, busy day yesterday, and it sounds like Plymouth did very well with our new town clerk in charge. Good afternoon. And unmute yourself, Ken.
Yes, thank you, Steve. Good afternoon. You're absolutely right. It was certainly a busy day. And I want to start off by first congratulating our two reps for being returned to their office. Wish you a very successful new term that starts in January. So best to both Kathy and Matt. Also, I want to say thank you to the town clerk's office. I think we've all had our fingers and toes crossed to see how this was going to work out and if we were going to be able to take the influx of voters and be able to get people through the polls in a reasonable time. That all happened. Town Clerk Pearl Sears has done an outstanding job. Her staff has been faithful in working with her. And I would be remiss if I didn't mention the poll workers that put in a very long day yesterday and did an excellent job. Thank you to everyone in the town that was involved to making this voting period as easy as it possibly could be. Also, I'd like the community to know that the COVID-19 memorial that Dr. Potvin had talked about a couple of weeks ago is up. It was put together on Monday, and I want to thank the Park Department and the Sign Department for all of their help. They did a great job. A comment that was passed on to me was from a resident of the town that said that she knew how many people had died, but it is much more significant when you see those empty chairs on the lawn, knowing that those folks, if it wasn't for COVID, probably would be with us and be at their own Thanksgiving table this year. So if you have the opportunity, go down, and it's a very good way to privately and quietly pay your respects to those that we have lost in the community. I also want to mention that the Board of Selectmen is concerned with the rise in the daily figures. They're not lessening, and I'm very anxious to listen to Dr. Potvin today. I know he has a great deal of information, as well as comments on the new restrictions that the governor has placed to try to combat this spread of the virus once again. So with that, Steve, I turn it back to you.
Thank you. That's Kenneth Tavares. He's the chair of the Plymouth Select Board. Each week we begin with our health segment, and joining us today, Dr. Philip Triffletti. He is an attending physician, primary care physician at Beth Israel Deaconess. Welcome, Phil.
Thanks, Steve. Thanks again for having me on the show. I very much appreciate being here, getting a chance to give you my perspective on an update on the COVID. As far as the update of the election, my wife, who is a Trump supporter, just texted me, and she's conceding the election. So we'll see if her predictions pan out. It's going to be a very interesting day today and going forward. But a lot of excitement, and it's wonderful to see how much the electorate has gone to the polls to vote. I'm really proud of our country for exercising the rights to vote. So to get started, I'm not going to really probably have a lot of earth-shattering news today as far as what's going on with COVID from a medical perspective, but I just wanted to update you and review some things. You know, I always do some research for this segment and, you know, confirmation of things I might have spoken about in the past, but, you know, we continue to learn more things about COVID as we go along. And so I do want to let you know what I think is staying the same, you know, where there might be, you know, a little bit more information that might fortify some of the decisions we make about, you know, trying to stop the pandemic. The first thing, let's go back to the vaccines. I mean, I really feel like the vaccines are, you know, our most promising, you know, way of stopping this pandemic. I wish we have a weekly lecture and a monthly lecture that with all the Harvard hospitals. And tomorrow's lecture is going to be one of the participants, Dr. Baruch, and several other participants who are building these vaccines. Dr. Baruch is doing the Johnson & Johnson vaccine. And so that's one of the ones that's quite far along in phase 3 trials. And so they're going to be talking to us about really how is the vaccine progress. So the next time I come on the show, you know, we'll have what I consider some really, you know, top-notch information to share with you about what's going on with the vaccines. But, you know, if you're watching in the media, you'll see that, you know, it does appear that both the Moderna and the Pfizer vaccines, which I've talked about in the past, likely will be filing for emergency use authorization in the next month or two. And so I think we can expect some limited supply of vaccine coming forward, you know, in the next month or two. And, you know, I would caution just to say that, you know, it will probably take some time to get large amounts of the vaccine so that, you know, that a bulk of the population will have access to it. But, you know, we will start with that prioritization schedule that's been mentioned, I'm sure, in the state of Massachusetts, where it's going to be healthcare workers who work with COVID patients, patients over the age of 65, and those with high-risk medical conditions. Obviously, the initial shipments probably won't be enough to cover all three of those groups, but, you know, that's how it will start. So anyways, I think we're just continuing to make progress. I don't see any snags with the progress on the vaccines. Very exciting. Second thing, I just want to mention, you know, scanning some of the medical journals. You know, one thing I found that was quite interesting was a study published about giving an intravenous medication that's called a neutralizing antibody. So you could think of this very similar to when they try to give the plasma with an antibody. And they did this study in patients who were not in the hospital, who had COVID-19 and had mild or moderate illness. And they found that they could significantly reduce the rate of hospitalizations. And they found that the hospitalization rate for this group with mild to moderate illness, they might have about 7% or so of the people get hospitalized. When they gave this neutralizing antibody to people who were infected, they could lower the rate to about 1.5% from the 7%. So I thought that was quite encouraging news about a new therapy that might eventually be available to give to people who have mild to moderate illness, but we want to prevent them from getting into a severe illness. So I thought that was very exciting. That's called neutralizing antibody. So that's still experimental. It's not on the market yet, but, you know, something to look forward to as the scientists, you know, continue to work on new therapeutic options for fighting the infection. You know, I'm sure you'll hear more from Dr. Potvin and others on the broadcast today about what's happening with the numbers. Unfortunately, you know, our numbers are climbing, you know, throughout Massachusetts, as you mentioned, also in Plymouth. And so I think it does, you know, require us to really reassess what we're doing, how we're doing things. And, you know, until we have the vaccine, I think that means, you know, working much more diligently on our mitigation strategies. I just wanted to give you some updates on my perspective on testing. You know, right now, in reviewing the literature, it still looks like when people get the nasopharyngeal swab, you know, up the nose, as opposed to getting tested through the mouth in the throat, the nasopharyngeal swab still seems to be somewhat superior technique for testing if you have to be tested for COVID. Also, when you're looking at the types of tests that are most accurate, it still appears that laboratory testing like is done often at hospitals. With the PCR technology, that still seems to be the most accurate way to do testing as opposed to some of the rapid testing methods that are used. So I would still emphasize, trying to get laboratory testing when it's available. Certainly, if you have symptoms and you're in a high risk situation, I think that's the best test. Very interesting, looking at how long do antibodies last after infection, and I saw some research that indicated that the antibody levels, might only last measurably in your bloodstream for maybe 3 to 5 months. So that's going to be a big issue, I think, of concern going forward, is trying to understand also how that might play into long-term immunity once you've had infection. And I was surprised to see that the antibody levels may not stay high for very long. And I think that's certainly been an area of concern, and we'll have to continue to watch, what the scientists find there. I think for people just to understand, I get a lot of phone calls. Should I be tested for reasons? What is considered a significant exposure? You probably know the CDC, defines it as, they changed the definition slightly, but it's if you've had more than 15 minutes of exposure to somebody who is known to be infected. And if these 15 minutes occurred within a 24-hour period, that would be considered a high-risk exposure, if you were within 6 feet and not wearing a mask. So those are some of the things to think about. A lot of times I get calls and people say, my son was exposed to a baseball coach and the son's fine. So a lot of these sort of secondary and, third levels of contact are probably not really significant exposures. But certainly if you're around somebody who was infected and you were within a close distance and it was for a significant amount of time and there were no masks, then your risks are certainly higher. And getting tested, I think, in those cases is worthwhile. When is the best time to test after exposures? Probably still around the 5 to 7 day period. We know the average incubation period is about 5 days. Oftentimes I might test people at 3 days and 6 days, if they want to, be ahead of the risk. And if you test somebody the first day they're exposed, you're not going to find anything. So you do have to wait several days usually to get any meaningful information. As you probably know, if you go into the hospital for a procedure or an operation that's elective, they'll test you 2 days before is what the facilities continue to do. And then the last thing, I can't help but talk more about masks. I did find more research about the effectiveness of masks. And, it turns out that universal masking, they had a comparison in cruise ships, one cruise ship that used, when they had infection, masks for everybody on the ship, and another cruise ship that did not, and they showed significant reductions in the number of people that got symptomatic infection. It cut the symptomatic infection rate basically in half, from about 80% symptomatic down to 40%. And then there's other evidence from other countries where universal masking is used. So I think when we think going forward, until we get a vaccine, what are some of the mitigation things that we can do? Whether you're at home or other places outside the home, I think that the more routine use of masks, at all times, universal, all the time, these are the things that you can see some evidence that this definitely reduces, the risks of infection. So, just continue to say, wear your mask as much as you can and get a flu shot. So look forward to any questions later in the broadcast. And again, thank you, Steve, for having me on today.
Thank you. That's Dr. Philip Triffletti, an attending primary care physician at Beth Israel Deaconess. You can send your questions to him and other members of our panel by writing to PlymouthInfo@pactv.org. And now we continue with our health segment. And once again, we welcome back Dr. Barry Potvin. He is the chair of the Plymouth Board of Health. Welcome, Barry.
Yes, thank you, Steve. There's a lot to get through. There's a lot of panelists, too. So I won't be able to get through everything probably today. Everyone should know that our Board of Health meeting will be moved to a Monday also because of holidays in November. So the next Board of Health meeting will be on the 9th of November, Monday between 4 and 5:30. And we will have more time to go through some of this information then if people can tune in. We'll also be having it on Monday prior to Thanksgiving rather than waiting until Wednesday because of the holidays. So some announcements and some observations first. There's only 3 states in the country at the moment that haven't been showing increased cases of COVID-19. And that offers one of those 3 is not Massachusetts. It has been going up here. I also wanted to make an announcement that we now have also in Plymouth new COVID-19 ambassadors. There are 2 of them. They're coming from a private security firm. They will be in uniform. They will have connections so that they can contact the local police if they need to. Their primary duties are going to be education, offering masks to those that don't have them. And if they have to, and only if they have to, they're also empowered by the Board of Health to also issue fines to the extent allowed by the state. And those fines are generally, as you'll hear in a minute, either $300 or $500, depending upon what the violation is. And they are per person. So if someone organizes a party and there's too many people and there's nobody wearing masks, the fines would be per person and it would be assessed against the party organizer. But I'll get into more in detail on that in a little bit. I should also announce that we have made a formal request to the state for a Stop the Spread location here in Plymouth. We're waiting to hear about it. So congratulations to our representatives who were reelected. We need your help because it's not easy getting those Stop the Spread locations put in place. And we're hoping that Plymouth will get one because the closest ones to us are really in New Bedford and Brockton. If we can get them, the testing is free of charge. It also does not require a doctor's note and it does not require any symptoms. And so it would be a really big help for us if we could have those available for anybody who needs them for any reason at all. Other things that I wanted to mention, Plymouth is still red. We are, I think, now 4 weeks into being red. There'll be another release put out on Thursday. And from the data which has been gathered that's going into that map, it's almost certain, although not finalized yet, that Plymouth will be red once again. It looks like the number associated with that, which is the positive cases per 100,000 on a daily basis, calculated over 14 days of data, is somewhere going to be around where it was the previous map. But that's, again, just a guess. So I did want to share with you, if I can do it, and I don't want to jump onto things that Matt is going to do, but if everyone can see this, this just came out on Tuesday, yesterday. This comes out daily, and it's usually posted around 5 o'clock in the afternoon. You can see that in the state, there's still almost 1,000 cases being reported every day. In this particular case, there were COVID patients in the hospital. That's been going up on a regular basis, slowly, but always, every day, it seems to be reaching higher numbers. In the hospitals in southeastern Massachusetts, the non-ICU beds are currently about, I think it was 67% occupied. So there are still 33% available. And of course, the smaller numbers are the ones that are in the ICU unit. And there are still, I think it's about 50-50 in terms of beds that are being used in the ICU and the ones that are still available. Phil may know more about that than I do. The one thing I really wanted to point out here, and this is a couple of really important things, is that the average age of people being hospitalized is now 67. And the average age of people who are dying from this is still 81. So it's the elderly people that are most at risk for hospitalization and for mortality from this disease. But you notice, if you look over at this chart on the far right side, we've seen a drastic change. This has been also mentioned by the governor on several occasions. It used to be, when this started back in March and April, that most of the cases were in the older age group, especially coming from congregate living facilities like nursing homes and assisted living facilities. Now, if you look at these numbers, it's just astonishing. So the largest numbers are in the 0 to 19-year age group, followed by those who are in 20 to 29 years, followed by those who are in 30 to 39-year age group. And then it takes a drop thereafter. And the ones we saw that were most likely to be positive cases in the older age group have now dropped down drastically. So I think that's important, and that helps to explain to a large extent why the governor came on his news conference on Monday and announced a series of new 3 COVID-19 orders. And they took effect, or they will take effect, at 12:01 a.m. on Friday. And they're quite important, and it's going to affect everybody, and it's going to affect all of our business community. So I'll just briefly go through them. I'll give you more detail if you tune in to the Board of Health meeting next Monday. But the first one, the easiest one to go through, is the new face mask order. So in this case, everybody over the age of 5 is required to wear a face mask over their mouth and nose, and that's important. If you don't cover both your mouth and your nose, you might as well not be wearing a face mask. People say that, well, this is to protect others, but it also has some effect at protecting you, because although it doesn't prevent you from inhaling and getting virus particles in moisture droplets, it does reduce it. And there's a lot of research now that shows that a lot of what happens to you depends upon just how much the infectious dose of these virus particles is. The more you inhale and get into your respiratory tract, usually the more likely it is that you'll show symptoms, the more likely it is that you'll probably have severe symptoms, and the more likely it is that you'll likely end up into the hospital. So it does provide you some protection. We urge everybody to do that. What's different is now that there is no exemption if you are 6 feet or more away from other people. It doesn't matter anymore. That's been removed. So if you're outside or inside, regardless of your distance from other people, you are required to wear a mask if you're over 5 years or older. And there is another exception, and that is when you're in a private automobile and the only other people in your car with you is either other household members or you're just alone. So you don't need to wear a mask under those conditions. You don't need to wear a mask when you're in your own home, unless somebody comes in from outside your home that doesn't reside with you. So again, these are some of the new things. There are some exceptions, but I don't really have time to go into it. The exception about medical reasons for not wearing them, they've changed that so that if you're talking about a school or an employment setting, the people who run the schools or run the employment setting are able now to require that you show proof of a medical exemption. That's not true otherwise, but it's true in the schools and it's true in workplaces. Enforcement of these particular regulations for face mask wearing, if someone violates them, the penalty is $300 per violation. The governor made it very clear that, again, the first thing you do is education and requesting that people wear face masks, give them one if they don't have one. And it's only people who will do this repeatedly and refuse to wear the mask under any circumstances that might be subject to a fine. So that's the governor's order number 55. The governor's order number 54 is about gatherings, and those have also changed. So now what's happened is that except for gatherings involving religious activities and political expression, their requirements or the gathering limits have now been reduced to 10 in a private residence indoors. So if you're having a gathering of people that don't live with you, so they're not staying with you in your own residence, you can only have 10 people in that setting. If you're gathering together in an outdoor setting, although it's private property, the limit is now 25. If it's a public setting, it's a little bit different. So in a public setting, indoor gatherings are limited to 25. And since we're a high-risk community, if it's an outdoor setting, it's limited to 50. And so that's been changed. Obviously, you still need to make sure everyone is wearing face masks. It's required if there's 10 or more people gathered together. There are some requirements about what you have to do if you discover anybody has tested positive that was together with your group. They have to notify the local boards of health. They have to provide a list of everyone who was at the gathering, and they have to answer all questions when the contact tracers contact the individuals. The penalty for this is much severe, and it actually is a $500 fine assessed against the party or the gathering organizer. So that's the quick summary of his order number 54. And number 53 is an order requiring certain business activities and limiting hours of alcohol and adult cannabis sales. So what's happened now is that at 9:30 p.m., all restaurants, and there's a whole list of other things that have to close as well. I don't know if I'm going to be able to get through them or not, but it includes pubs, bars and grills, arcades, indoor and outdoor recreation facilities, indoor and outdoor events, youth and adult amateur sports activities, golf facilities, wildlife reserves, nature centers, any close contact personal services, which would include things like hair styling salons, barbershops, massage places, fitness centers, health clubs, indoor and outdoor pools, all have to close at 9:30. The exception is if it's a restaurant, restaurants are able to still do takeout and delivery services for a half hour later, so up until 10 o'clock. That is because the governor wants everyone to know that there is now a stay-at-home advisory again, and everyone is supposed to be home in your residence with your family at 10 o'clock every night. And there are some limited exceptions, but again, I don't really have time to go through those right now. There's also a regulation banning the sale of alcoholic beverages or the serving of alcoholic beverages, and the cutoff is 9:30 p.m. So that covers restaurants, pubs, bars and grills. It also covers package stores, liquor stores, 7-Elevens. So it is now illegal to sell alcoholic beverages after 9:30 p.m. And that's also going to be applied to anybody who is selling adult use marijuana. Same thing, 9:30 p.m., sales stop, serving of those materials stop. And that's to give everybody time to get home by 10 p.m. So obviously it's not a curfew, but certainly he's doing everything he can to encourage people to be home with your family in your residence by 10 p.m. at night. I could talk a lot about why that happened, but clearly part of the reason is that it's aimed at that group that you just saw, which are the younger adults, which tend to be usually the ones that tend to be out at restaurants, bars and grills, and perhaps going off and stopping at liquor stores and package stores later on in the evening. So it's an attempt to control that. A lot of people aren't going to like this. A lot of people say it's overdue. Some people say it's not enough. But really the reason for it is if you look at what's going on in other communities and other countries around the world, there have been severe, really stringent lockdowns and curfews put in place. And we don't want to go back to that. That's very damaging. Obviously, we're trying to protect the schools, which are doing a great job. I don't think I should take any more time right now, but again, if you have the time to watch the Board of Health meeting on Monday evening at 6 o'clock, we'll be going into more detail at that time. Thank you, Steve.
Thank you. That's Dr. Barry Potvin. He is Professor Emeritus, Yeshiva University, Department of Biology. He's an epidemiologist. You can send your questions to PlymouthInfo@pactv.org. And today we welcome back Plymouth County Register of Probate, Matthew McDonough. Matt, last week, one of your courthouses in Brockton was closed for the day. Give us an update about how the coronavirus is affecting your work and your workplace in the courts.
Steve, thank you for the invitation to be part of your COVID-19 update to your viewers.
We heard the thank you. I'm not hearing any more. There you go. Go ahead.
Okay. Yes, thank you very much for being a part of, for inviting me to be a part of the show today. As you noted, we did have a COVID positive test for one of our employees last week in the Brockton Trial Courthouse, and that resulted in a one-day shutdown for the courthouse where they could clean the courthouse, conduct the contact tracing that you've heard about from your Board of Health member and also from the doctors in this show. What I can say about it is that we have had these types of brief shutdowns in the past 8 months. And what has been a progress for us is to make sure that we're doing it faster. We're doing it with greater efficiency. Our staff within the trial courts are becoming more accustomed to this process, even though it's something that we do look forward to the day where we don't have these types of processes. And we've been able to get up and running quicker. One of the notes that's been shared with me from the administrative offices is that although we have had a dozen or so positive tests in the trial courts, we're very proud that we've been able to contain those tests using these protocols efficiently and effectively to make sure that there's no sharing or spreading of the COVID-19 virus from those employees to either the public or to their colleagues within any of our divisions. So what we're doing right now is working. And some of the things that we're doing here in the Plymouth Overbury Street Courthouse, where I am today, I wanted to address as well. One of the questions that I've been getting most frequently actually does not have to do with probate and family court or civil courts, but actually to do with the criminal court system in district court with the jury of 6. I know that currently the standing order on the mass.gov website for the trial courts indicates that jury trials for jury of 6 cases would resume no earlier than November 9th. Now, I've received some feedback that folks who have had jury summonses sent to them, they have contacted the office of the jury commissioner and been notified that their service has actually already been continued. So if you do have any questions, because November 9th is coming up quickly, please take the opportunity to contact the jury commissioner's office if you do have a summons to serve in the jury trial system, and they will direct you as to when or if you're going to be continued. At this point, my understanding is when juries do resume, they're going to be in our larger buildings where there is opportunity for social distancing. They're going to be very limited in nature and very limited in numbers so that we can make sure that we get this right as we go forward with trying these cases and trying to make sure that access to justice continues throughout the COVID-19 pandemic. Within the probate and family court, we have done a lot of great work in the last 8 months, and I've been proud to be able to share some of that over the last few shows that I've been invited to. Right now, what remains most trustworthy and helpful for us to help you is our phone system. We do cases by Zoom. We have telephonic hearings. We have a website that is available, an email address that is available on the mass.gov website to send us emergencies only. But the fastest way that we can help you and the safest way that we can help you remains our 2 phone lines. The Plymouth phone number is 508-747-6204. Our Brockton phone number is 508-897-5400. Our front counters are open in the Plymouth and the Brockton courthouse, but most of the matters can be handled remotely by phone or by Zoom hearings. If you are coming in person, I just like to set expectations for people when they come into the court. As you enter our court buildings, you will be approached by court security. They will take your temperature on your forehead, and they will ask you a series of questions about whether or not you have been ill, have had a fever, or have anybody in your close family who has been ill or has a fever recently. They're going to mandate that you wear a mask. Masks are essential, as you've heard from the early participants in this program, in making sure that we don't spread this illness to other people. When you're in the buildings, you will see hand sanitizer stations as well as a lot of signage now to direct you where to sit appropriately so that we can maintain social distance within the building. And we also have a cap on the number of people who can enter either our Brockton or our Plymouth courthouse, and court security manages that at the front door as well. So if you do come into our office and you need to use our drop box, where we do have an opportunity right outside of the Plymouth and the Brockton registry to drop off filings and paperwork, which allow us to safely handle them the following day, you can do that. What I ask, though, is that if you put them into a secure envelope and they are an emergency matter or a matter where you think they need to be heard or dealt with within the next 24 hours or sooner, please note that on the exterior of the envelope and on the interior of the envelope. Make sure that we have your cell phone number or email address so we can communicate with you or your counsel as soon as possible. Other matters that I want folks to know about is that we accept credit cards, and we have waived our prohibition on accepting credit cards by telephone. So if you do need to make payment on a case, we can accept that by telephone as well. We're now about 1 to 3 weeks in our turnaround time with new filings, and that has been great improvement considering the shutdowns that we've had to go through in the early months of COVID. and our intermittent shutdowns that we've had when we unfortunately do have somebody in the building who has tested positive for COVID as well. As we approach the holiday season, we ask everybody to be careful. Please make sure that you call us if you can, and understand that as we go into the holidays as well, we may have a little bit of slowing due to positive tests and scheduling issues with our own court staff. If you do have something that needs to be expedited or an emergency issue, such as a restraining order where somebody is not safe in their home environment, or in the real estate market, if you have a house that is part of a probate and an asset within a probate case, and you're looking for license to sell, please call us as soon as you can, and we can always make the opportunity available to expedite a case to the best of our abilities. One last reminder, we do accept our emergency cases, and they are assigned to one judge at a time. Most of our emergency cases are being handled by Zoom or by telephone. So if you could tell us that you have an ability to participate remotely when you first contact us, that will help us to determine how we can best get that case heard by the judge. If you have any questions for me, Steve, or your panel, or anybody in the public follows up with you with a question, I'm happy to research it and get back to you all as soon as possible. One point of personal privilege, as one of the prior speakers said, yesterday was election day, and I was fortunate enough to be reelected as Register of Probate for Plymouth County. And I just want to thank the people who are viewing through PAC Television and let them know that it is my deepest honor to serve them in the Probate and Family Court.
Thank you. That is Plymouth County Register of Deeds, Matthew McDonough. Matt, congratulations on your reelection. You've certainly served well, and in your dealings, the dealings that we have with you, we're always very pleased at the professional manner in which you and your staff respond. So thank you for that. And at this time, we're going to now move to another professional part of our town, and that is the Plymouth Public Schools. And today we're joined by Erik Cioffi. He is the Assistant Superintendent for the Plymouth Public Schools. Welcome back, Erik.
Thank you, Stephen. Thanks for having me again. As you can imagine, there's a lot of conversations that we have on a routine basis in the public schools. We just had our last school committee meeting this past Monday. Some of the things I wanted to share is, Dr. Campbell started up our community health advisory team, and we've got close to 40 members, and it's made up of not only district staff, it's made up of instructional staff, students, parents, community members, school committee members, and we're all coming together and then coming to having our breakout sessions where we're able to really focus on our communication with the community and our parents, the educational component to make sure that we're targeting our standards and having everything move forward. We're having health and safety committee within there for not only our students, but our families, and then our facilities and school operations. So we just started those meetings this past week, and we're going to continue those on so that we can collectively work together to support the school committee and the central office. So that's been a great thing. Obviously, we follow and look at our COVID dashboard here at the school system, and we're constantly monitoring and having several conversations each week with the Board of Public Health, our contact tracers, and what we're seeing, if you've looked at our dashboard, is we're trying to make sure that there's no cluster spots within the schools. And Governor Baker did share that he felt like the schools were doing things in the best interest of students, keeping them safe. One of the challenges we have right now continues to be the outside school exposures for our primary contacts that end up getting quarantined. When you start looking at our staff that might be exposed outside and then they're not able to come in, that becomes impactful within the schools. And one of the examples I can give you today is we have 41 staff members that are out. Not all of them are quarantined by any means. Some are out due for previous scheduled medical procedures or a sick child at home, and so forth. But we had 17 of those positions not filled with our substitutes. So that was going to be one of my pleads today, is if there's anybody listening that has been interested in the past or would like to support the schools, becoming a substitute teacher is a great way to help support us. We recently were able to increase the pay rate to $110 for our non-certified applicants and $125 if they are certified. When we don't have the staff in the buildings, we're using our paraeducators, other teachers are covering, and it just makes even more of a challenging day for the schools. So that is just definitely one area that we're looking to try and get ahead of. I appreciate Dr. Triffletti talking about the flu shots. That certainly is something that is required of our students in Plymouth Public Schools. And that deadline is fast approaching, December 31st. We have to make sure that our students have been vaccinated. There are some options if there is a religious exemption or if there's a medical exemption that needs to be submitted to us. As of today, we've only received 25 of those. So we do know as seasons are starting to change, which is something that we've had a lot of conversations about. Just this past Friday, it was a very different weather pattern. I know the staff here was excited about seeing some of the snowfall. I thought it was a full-blown blizzard, coming up from the south. So it was something to certainly start preparing ourselves for. And when speaking of the changing of season patterns with, the flu opportunities that kids might get exposed to, more kids are going to potentially get tested. There could be some increase in COVID results possibly. But we're also looking at some of our buildings. We have some very historic buildings that are, especially in our elementary schools, that don't have the natural airflow patterns that we've been able to mitigate here in the early start of the school year with keeping windows open and having fans kind of circulate the air around. Well, that doesn't sound like a really good idea in January when it's going to be very cold out. And so our system has been already thinking about that, and we are providing. We've gotten some purifiers that will help circulate the air within the classroom. We've got 110 of those ordered to go into all of those specific classrooms, so we can keep the climate as comfortable as possible, but still follow our DESI guidelines and guidance we get from the Board of Public Health and from CDC and all the different organizations as we make our decisions. We have just as many families that want to return full as are hesitant about coming back, and we have to find that balance. We will always make sure that we're keeping in mind our students and our staff's safety. As well as following the guidelines that we've been given, social distancing, 6 foot apart. Transportation, has its own set of guidelines that we have to follow with the number of students that can ride the bus, plus as far as keeping windows down. So masking is critical. I appreciate it as well when that was discussed. I think our schools, going into our schools, our students and staff have done an outstanding job of doing that and doing those appropriate mask breaks. The social distancing piece is when they're sitting in the classroom is obviously a lot easier to manage because they're stationary. As kids get moving around and they're outside, they're still kids. They can still get kind of, they navigate towards one another, and our teachers have done a good job just constantly reminding them to separate. And our hope is, as we share these practices, the washing of the hands and masking up on a routine basis, that they're carrying that out into the community. Because what we see is within the schools, we feel like, there are going to be unique cases that present themselves, but I think our principals, our school nurses have done a tremendous job of getting that information. And I do want to give a huge shout out to the families who have notified us the moment that their child is getting tested, or if a test comes back positive or negative. That allows us to really do a good job of contact tracing and making sure that if there are other people that potentially were exposed, we can deal with those students and staff members as quickly as possible. So getting that information is critical. Even though we get the information a lot of times straight from a parent, we react to it. We quarantine students as needed. We get notification out through a letter from the individual schools. We haven't updated our dashboard until the cases are put into the Maven system, so there might be a little bit of lag time there, but we're staying on it, and we appreciate our family support. We've had a group of parents out here last couple of school board meetings, and pleading for full on return, and there's nothing more than what we'd like to do is have our kids back in daily. But we can't risk exposure to students, and we can't go against the guidelines. So we're constantly looking at the different models, and we'll continue to do so. And hopefully the end is in sight. I want to keep hearing about vaccines, and so we can get back to doing what we normally do on on a yearly basis, which is educate our youth.
Thank you. And that's Erik Cioffi. He is the Assistant Superintendent for Plymouth Public Schools. You can send your questions to plymouthinfo@pactv.org. We now welcome back Plymouth State Representative Kathleen LaNatra. Kathleen, congratulations on your reelection and welcome back. And if you can unmute yourself, Kathy. You're muted.
You would think I would know better after all this time,
You're
right?
good now. Go ahead.
Gee, that's an easy thing to forget. Thank you, Steve. Thank you, everyone on this panel. I've learned so much, a wealth of information here. I will say my husband was asked to be a substitute teacher a couple years back at the Silver Lake High School, and he found that extremely rewarding. So if it is something that you think you may be interested, I would definitely reach out because he did find it very rewarding and misses it, actually. We've touched on so many great things here, so many important things. The stay-at-home advisory we've touched on, Department of Health, from the hours of 10 p.m. to 5 a.m. That's going to start on Friday. That was mentioned. There are some exceptions, of course, to work, to go to the grocery store, the pharmacy, to pick up takeout food. So otherwise, if you don't have those exceptions, you really need to stay at home. And as was mentioned, we do have some fines. Restaurants will stop seating at 9:30, which we've mentioned already, except for pickup and delivery. Governor Baker does not want to shut down the economy. He wants to keep it going. And this is the way I think is a middle road that we'll be able to do that. And as mentioned in schools, I know as a parent, we all want our kids back, but we want to do that very safely. I appreciate all the hard work that's put into this show that's weekly and has kept all the constituents up to date. Myself as well. I learned a lot today from Dr. Triffletti, and I really appreciate that. And I know we're running out of time, so I'm just going to pass it along. But thank you again for being here. You know that you can reach out to Matt and myself at any time with any concerns and questions that you have that are going on. So thank you, Steve.
Thank you. And that is one of our state representatives for the town of Plymouth, Kathleen LaNatra. We're now going to go to Stephen Cole. Welcome back, Steve.
Hi, Steve. Hi, folks. Glad to be back. Thanks for having me. I'm going to keep it brief this afternoon. I'm going to talk about three things very quickly. First and foremost, we'll talk about unemployment, talk about some small business assistance, and the Federal Reserve Program, and report on regional property values. So first, last time I was here, we mentioned that the unemployment rate had fallen at that point to 8.7%. I'm glad to report that we've fallen further still to 7.1%, and that's as of mid-October. Usually these numbers come in about a week or two behind contemporary time, so to speak. So my sense is that by the next time I appear, we'll probably be right around 6 or 5%. When we started all of this, we were at 4%. I just want to remind folks at the start of this year, we're at 4% unemployment, and we held high at about 18.5% through April, May, and June. We only fell below 10% in September. So something to remember. We have a lot of progress to do to make still, but we are in a good situation, as I've been saying all along. Plymouth has been well situated for a full recovery, certainly better than other parts of the state. We started this year, as I said, with a 4% unemployment rate. The state was at 2.8%. So even at 8.7%, which is what our region rate is, and 7.1%, as I said, we still have some work to do. If you are in a position where your job is not there waiting for you after this, I really do want you to give some serious thought to starting your own job, creating your own business. If you don't know how, give us a call at the foundation. I'll be very glad to help you through it, help you start your business plan. I also want to mention that the Fed Reserve made an announcement to their change to their Main Street lending program so that small businesses and nonprofits can more easily gain access to direct lending from the Fed Reserve. This is intended for businesses that were in sound financial condition before COVID. It offers 5-year repayment options with deferred principal and interest payments. This is a part of the CARES Act. Dived a little bit into it this morning, and I saw that about $3.7 billion has so far been spent, and there's about $75 billion in the program total. So if you're a small business, you're listening to this program today, if you think you might be eligible as a small business or a nonprofit, feel free to reach out to the foundation, and I'll help you cut through some of the red tape to see if you're eligible. Lastly, Steve, I want to share some optimistic news coming out of the Fed Reserve also with their comparative analysis with New England states and their property values. All 6 New England states are actually reporting between Q2 2019 and Q2 2020 that property values are actually up. Massachusetts Massachusetts is seeing about a 3.5% increase in property values in that same time frame. That's on par with what we're seeing in Vermont. Connecticut is trailing a little bit from the rest of the New England region, but Maine and Rhode Island are well above 5.1%. So I think we know where people are relocating. Some interesting info also I'll share. This was also part of the conversation with the Fed Reserve. Airline passengers into Boston is down 80%. That's actually up from 90% in April. So I'll tell you also that only half of international flights have actually been resumed at this time. So it'll be a little bit longer before we see any kind of return to the tourism that we wanted or that we expected to see. And I think it might be a little time before we see the full return to unemployment like we've seen it before. But just know the foundation's here. We have great board members, excellent leaders in the community, perfect connections, I dare say, to our funding partners at the Fed and the EDA. If there's any questions anybody has during the broadcast, I'll be glad to research it further and report back. Thanks, Steve.
Thank you, Stephen Coles, the Executive Director to the Town of Plymouth Regional Economic Development Foundation. At this time, we're going to go to our Plymouth State Representative, Matthew Muratore. Matt, again, congratulations to you on your reelection yesterday, and welcome.
Thank you, Steve, and thank you to all the voters out there who voted. And I want to add my congratulations to the town clerk as well, and the clerk's office and the poll workers. You know, considering the amount of people that voted in the town of Plymouth, I think it's somewhere around 80%. The amount of early voters we had, the amount of absentee ballots, and the amount of people that came to the polls yesterday, it was amazing. I think Kathy will join me in this to find out that we actually got our entire numbers by around 9:30 last night. Which is really incredible considering the amount of people that voted. It was really smooth. So we thank Pearl Sears and the staff and all the poll workers for that. And I happened to be out yesterday morning, very early, 4:30 in the morning, going to the different polls and getting things ready. And I was struck at the town hall. And I know Chairman Tavares brought this up about the chairs and the lights that were out front on the front lawn of town hall. You really just had to stand there for a minute and just take it in. And I know Barry was, one of the ones that really wanted to have this shown on the front town lawn. But it is very moving to actually see that. So if you do get a chance to go down to town hall, particularly now that it's getting dark out at, 3 o'clock or 4 o'clock, whatever time it is, feel free to go by there. Just take a look and just stop, just pause. It's really amazing. So a nice job with doing that. With those chairs and those lights out there. The DPW did a tremendous job. I do like to be last all the time. It usually takes me a couple hours to prepare for this show, but I do like to be last because then I just go through my list and just check everything off that everyone talks about. And I think Chairman Potvin took almost everything off my list today, and then Kathy just took the rest. So the only thing I am going to add to today is the 7-day average positive test rate in the Commonwealth right now was at 1.78%. The average hospital age, as Dr. Potvin indicated, was 67. The total confirmed cases since we began this back in March is 157,308. The average daily incidence in the last 14 days is 11.8 in the Commonwealth. Hospitalizations, interestingly enough, have gone down since last week. Last week, we had 567 folks in the hospitals throughout the Commonwealth. Today, as of yesterday, was 585. The ICU beds, those were in ICU beds last week. That's gone down from 109 to 96 this week, with 51 who are on vents. The total deaths continue to climb, but at a slower rate. We're at 9,809 deaths, with 6,436 coming from long-term care facilities. And I just want to emphasize, the point of what Dr. Potvin was making with the age groups, and I actually had that on my list as well, is that, yes, a lot more younger people are getting it, but the people that are really getting sick and still dying are the elderly people. And you don't know when you're coming in contact with somebody when they will get it. It could be you may have it, you may be asymptomatic and have it and give it to somebody that that you're hanging out with at your home, who's a healthcare worker, who works at a nursing home or assisted living or a hospital, and they give it to an elderly person and they end up dying from it. So that's what this is really all about, of wearing the mask. So I just really wanted to emphasize that point, Steve. And also in Plymouth County, believe it or not, Plymouth County is really has the highest rates of deaths at this point at 8.4% in the last 2 weeks of October 12th to October 25th. So we are in really a red area. It's not just Plymouth, it's surrounding us as well. So the governor's orders, I think we need to take take serious, do what we can to help lower the rate of infections that are happening. Plymouth County has seen 11,747 cases so far to date, with 843 deaths. Plymouth has 923 cases. In the last 14 days, there was 79 cases altogether. That's a 9.1 incident rate, a little bit lower than the state, but still higher than the threshold. There's been 3,618 tests in the town of Plymouth for people as well. So we really need to, again, continue to be vigilant. And I also want to commend the schools for what they're doing as well. It's just amazing. You look at the numbers on the dashboard that come out every Friday, and just looking at it now, there's only three new reported cases last week in the schools for students out of 7,200 students. I mean, it's just amazing. With the teachers, there's almost 1,400 teachers and employees altogether, and there was only 2 cases there. So the schools continue to do a fantastic job, and I want to make sure we highlight what they're doing. And that's all I have for today, Steve.
Thank you. Matthew Muratore, Plymouth State Representative. We're going to go back through our panel so they can provide us with their closing thoughts. Also, a few questions. Going to begin with Dr. Philip Triffletti. Dr. Phil, question from Mary. If you choose to travel for Thanksgiving, I assume this question was out of state, how long should you quarantine on your return, or what about testing?
Yes, that's a great question. I haven't looked at the recent state guidelines. I know that the governor has put together a list of states where, quarantine is required, or the alternative is getting tested, I believe it's within 72 hours to make sure that you don't have COVID when you return. I think most people prefer to do the testing over the quarantining, but I think that's a great idea. I think as long as you have testing available in the community, and we can do testing to make sure that people are not bringing infection back to their homes and to their communities and the state, I think that's a great thing to do. So I think for most states, except for the Northeast, we're encouraging either a 14-day quarantine or, testing within 3 days, a COVID test. If any other panelists have any further information, I'd welcome it. Thanks.
Thank you. Going to go to Dr. Barry Potvin. Question for you, Dr. Potvin. Please share the current status of contact tracing in Plymouth. How many tracers, their schedule, the results, any tracing related to the skateboard park, the waterfront, other public gathering places, and private gatherings. Dr. Potvin.
Well, the contact tracing is partly done by the state and partly done by our own Department of Public Health staff. So in terms of trying to get names of people who might have been exposed, that usually goes pretty well, but there is some difficulty getting that information from people because they may not want their friends to actually have to undergo quarantine. So they tend to be a little bit reluctant to give out the names. In terms of where the diseases are coming from initially, it's very hard to track that. There's a lot of information about household transmission, but we don't know where it came from when you talk about the first person in the household that became infected. Some cases it's from workplaces, in some places it's from private gatherings. So the contact tracers have a lot of difficulty assembling that information for us, but they work at it very hard to try to do it. So it's vital if the contact tracers actually contact you, that you give them as much information as you possibly can, and that will help to control the disease.
Thank you. Dr. Barry Potvin is the chair of the Plymouth Board of Health. Going back to Matthew McDonough, Plymouth County Register of Probate. Matt, what is your takeaway for today?
In summary, Steve, I'd just like everybody to know that we have expanded the case types that we're now accepting at the probate and family court. We had started in March with just dealing with emergencies. We accept all case types. We do, however, have a priority that we try to do everything remotely. So please call us at our two offices at 508-747-6204 in Plymouth, 508-897-5400 in Brockton, and we will find a way to get you and your family access to justice in the safest possible way. And if I don't see you all before Thanksgiving, I hope you have a wonderful and safe holiday season.
Thank you, Matthew McDonough, Plymouth County Register of Probate. We're going back to Erik Cioffi, Assistant Superintendent of Plymouth Public Schools. And Erik, a question from a viewer. By the way, the earlier question, Dr. Potvin, was from Martha. This question from a viewer: what qualifications do people need to be a substitute teacher if they're not certified educators by the state? Erik Cioffi.
They have to be high school graduates. We are looking for candidates to be over the age of 21. But if they are non-certified, they don't have a teaching certificate, our rate of pay is $110 a day. And then if they do have a certificate or they have an advanced degree, they would go up to 125. So I'm glad people are calling in. Ask that question. Our applications are on our website. And if they're having any difficulty there, you can certainly call our Human Resource Division here at the Plymouth Public Schools, and we can help people through that process.
Thank you, Erik Cioffi, Assistant Superintendent, Plymouth Public Schools. Representative Kathleen LaNatra, your closing thoughts.
Thank you. I unmuted this time, Steve. You should be proud. Closing thoughts. You know, we all need to wear our masks. We all need to stay in from 10 p.m. till 5 a.m. unless we need to be out for a medical emergency or takeout or groceries or the pharmacy. But wear your masks. We need to get through this all together. And if you're near your town clerk's office in Plymouth or any other town, just stop in and give them a big thank you. They put a lot of work into this election. It was a record-breaking turnout, and they really need to be thanked for that. And again, I thank all of you for all your information and all the hard work that you're doing. And I appreciate this show. Thank you, Steve.
Thank you. Plymouth Representative Kathleen LaNatra. We're now going back to Stephen Cole, who has been heading up our business segment today. Steve, what's your takeaway?
Just want to remind folks that we've been very competitive in finding outside funding opportunities to support our focus and our mission here at the foundation. In addition to encouraging folks to start their own business to solve that jobs gap that I mentioned earlier, I want you to know that we're going to meet you at least halfway. We earned $200,000 in a competitive grant from the EDA just a couple of months ago. Some of your viewers may remember me mentioning that in the past. We're getting ready to put that RFP on the streets. There was some delays for all the obvious reasons. But my expectation is that by the middle of next year, we will have in place a strategy to create an entrepreneurial center that will feature hackerspace, makerspace, tinkerspace. They're nuanced, but they are different. An industrial test kitchen or ghost kitchen, it's been described as well as some professional offices. 3D printing is also part of that. So we'll be studying the entrepreneurial ecosystem in Plymouth and Barnstable counties, and hope that by the end of next year, we'll actually have a facility in place. Stay tuned, folks. If you have any questions on the matter, do feel free to reach out. Thanks, Steve.
Thank you, Stephen Cole, Executive Director of Plymouth Regional Economic Development Foundation. Plymouth State Representative Matthew Muratore, you'd like to be last, so go ahead.
Thank you very much, Steve. Although I didn't want to be last yesterday, so I don't always like to be last. So you got to make that clear. Just want to finish answering the question about the travel as well. If you're coming back from a low risk state, then you don't have to quarantine. But if where most of the states are at risk, you do have to have a test 72 hours before arrival in Massachusetts. And there is a form on the mass.gov website that you need to fill out. So feel free to please take a look at that and do that. That's mass.gov/COVID-19. And Steve, the takeaway today is, I think with Kathleen and myself, we are actually back in session again tomorrow. We're actually going to be starting the state budget and finalizing the state budget for this fiscal year. Believe it or not, it hasn't been done yet because of everything going on. I think our priority is going to be this legislative session coming up. It's going to be COVID and the economy. And what I say every day is controlling COVID is good for the economy. It's good for the health and it's good for the schools. So thanks for having me on again today, Steve.
Thank you, Plymouth State Representative Matthew Muratore, and to all our panelists, Dr. Philip Triffletti, Dr. Barry Potvin, Plymouth County Register of Probate Matthew McDonough, Erik Cioffi, Assistant Superintendent of Public Schools, Representative Kathleen LaNatra, and Executive Director Stephen Cole. And next week we have joining Ken, Matt, and me, Dr. Mark Wilson, Sarah Cloud, a representative from the school department, Heather Crosby, Michael Jackman, Michelle Brady, and Amy Naples. And now Ken Tavares, Chair of the Select Board, your closing statement. Ken. We see Ken on the video, and unmute yourself, Ken, if you can. There you
Sorry
go.
about that.
We can hear you.
Okay.
Welcome back.
We have really much work to do, and it's very evident after listening to all of the speakers today. But our town is worth it. Our Commonwealth is worth it. Our country is worth it. And most important of all, you are worth it. Let's continue to work together, and we will defeat this virus. Thank you.
Thank you, Ken Tavares, and thank you to all the participants, all the viewers for watching. Special thanks to PAC TV for helping us bring this coronavirus update to the town of Plymouth each and every week. I'm Steve Triffletti, Plymouth Town Moderator. Please join us next Tuesday, November 10th, the day before the holiday, for a special presentation. Good day, and thank you.